Shannon.
Hi, Leah. I work in the Tele-ICU, and I'm a BSN CCRN, and I've been here since the inception of the Tele-ICU at Fairview.
And how are you liking it?
I've really enjoyed it. It's been a great experience. It's nothing like I expected it to be, though. When we first started out, the biggest struggle, and it still can be, like with newer nurses in here, is effective communication. Having to use the camera, having to talk via phone, and having to figure things out via the computer is so much harder. And also probably another struggle for most of us is losing, we don't have any control over anything, it seems like.
Yeah. And how do you think the nurses have responded to?
Well, it's real positive for some, especially probably newer nurses, because we can be, like, if they're not comfortable going to the charge nurse, sometimes we're just kind of a second set of eyes, and they can come to us and ask questions that they might think they're afraid to ask other people.
Sure. And what do you think the biggest benefit has been?
The biggest benefit, I think, is that we can keep patients closer to home. So especially in like the community hospitals, even ridges, people can stay closer to home and be sicker and be managed and get better and go home. The family doesn't have to stay in a hotel room. They are in their community, and they just feel more comfortable. So.
Absolutely. And has this been a positive change in your career?
I think so. I've been a nurse for 20 years, and it's just added another facet to my education, like my self-education. Being able to work with intensivists 24/7 and knowing, learning what each one does and how each one practices, and you end up becoming intimately aware of how each intensivist works.
Absolutely.
So,
well, thank you for your time and for sharing your thoughts with us.
You're welcome, Leah.
Okay, take care.